Everyone, welcome to the podcast. We all have seen the journey of our doctors that are really doing so well, and we always take time key how they have planned, how they have reached here. So, today I really got an opportunity, and to be very honest, it's a dream moment for me also. We will learn about the journey that he has, the way he planned his cases, the way he planned his clinical practice, and way he always takes steps to educate students. He has really done some great cases, and we all have seen. So let's take a moment and understand from him that how he did all of this. So please welcome Dr. Darshan, and this is gonna be a great podcast full of insights for all the doctors out there. Can't wait to share with you all. Let's dive in and let's understand from him the all the importance of the journey, the importance of clinic, the importance how to educate yourself and how to manage, as well as how to deal with the failures and just go to the success. So let's dive in and let's understand from him. Implants are nowadays it's a lot going on. So what do you believe that how implant is changing the dentistry?
So implants have been here for a long time. Okay, it's almost now 80 years that we are using it. The technology has improved tremendously, and implants as a procedure have become very predictable. There was a time initially when we depended a lot on whether it would integrate or not. Those were the fears. Now integration is a given,
Yeah.
right? Now our job right now is to make it better and better. Okay, it is a form of rehabilitation, and it is the number one form of replacement of tooth. And anyone who's practicing dentistry in this age today and does not offer implants is doing a disservice to the patient.
Correct.
Okay, whether you do it yourself, you get in a consultant to do it, or you refer the patient out.
Mm.
Always, the patient should have implant as choice number one for replacing teeth.
So how the clinical diagnosis, the treatment plan, the amount of the time they will take for the recovery. How does you plan all of this?
So it depends on the patient per se, whether the patient is available to me or not. See, often our patients come with a limited time frame. So often we have to split up the treatment into two parts. Sometimes there is a surgical phase and a prosthetic phase. Uh, the diagnosis and the treatment planning is something we concentrate a lot on. So I would say when the patient comes in, we will first evaluate the patient per se, evaluate his mouth, see what all is there to be done. Okay, implants is just a part of the treatment.
Yeah.
Okay, often they come for implants, but then we have to treat a lot of other things first. So it goes the same way. See, if we can get the mouth in order, then we do all the restorative work which is necessary. There are times when we bring the teeth to a level that the restorative phase is at a temporary stage and then the implants are placed so that we can finally do the complete rehabilitation later. So, if you're asking me about the recovery of the patient, generally being a planned surgery as being a clean surgery, there is not much pain after implants. People think that it is a very painful procedure, but it's not. To tell you the truth, very, very, very few patients complain of pain after an implant placement.
Mm.
And even if they do, it's only for the first day. So we explain to the patient that day one is generally the pain day, okay, in which you will require painkillers, sometimes three a day. Day two is more of the soreness, difficulty in opening the mouth phase. Day three is the swelling going down phase. But generally, most patients don't complain beyond day one. They're very comfortable on day two.
Yeah, but why is that? Because I think because of the anesthesia, they feel more pain in day two, or why is it?
See, it's always like that. Initially, when you do it, you have the it depends on what you're doing. Sometimes if you're doing an extraction and an implant placement at the same time, there's a little more pain because the process of extraction of the tooth is generally more painful because of the pressure involved. But if you're doing a pure placement in a tooth which is area which is mature bone, then not much pain. I've never seen the patient complain of pain.
Okay. But as I'm seeing some of the cases, so still patients, the dentists are more into implants right now because they feel that why to disturb two other teeth also, and they prefer implants. But for the patients, yet it is not so comforting choice. So how do you manage to explain them that why implant is more comforting than going to the RPD?
So RPD now is as a treatment form is almost out. If you're talking about a FPD, fixed partial dental, which you have to actually
Yeah.
cut to adjacent teeth, the choice is clear. The
Mm.
situation with implant, you are replacing the entire biology. Okay. Once a tooth is lost, you understand the sequelae of that, right? There's a lot of volume, there's a lot of the inguinal architecture, there's a lot of bone. If you're placing an implant in that same space, you're restoring everything back.
Mm.
You're
Mm.
also stimulating the bone in that region. An area which has an implant there rarely loses height, right? Because the implant itself props it up.
Yeah.
So with all these things in mind, there is no question that an implant is definitely the number one way of replacing a tooth. Now, the only reason patients choose FPD is either because they are scared of the surgical procedure,
Yeah.
one,
Mm.
the financial aspect, and three, the dentist promotes it as a way to finish it quickly. Because they themselves don't offer that treatment. And
Mm.
that's why the first thing I said that, a dentist's prime responsibility today is to offer that as a form of treatment. So this is the number one form of treatment.
I think this gonna help very young dentist a lot because first two, yes, as a patient it is, but the main thing is how we explain to the patient that matters the most. So if you want to say this to any young dentist, so how you will tell them, how you will make sure that they explain well.
So I'll tell you what, when I was very young and I was starting my practice in implants, I had a conversation with a very senior dentist who was offering implants.
Mm.
And he gave me a piece of advice. He said that the one thing that patients fear the most is the surgery.
Mm.
So while you explain the surgery in detail, you downplay the actual procedure because it is not a big procedure to get
Mm.
you.
Mm.
So you tell him that थोड़ा injection लगेगा,
Mm.
छोटा cut लगेगा, and टाके लगेगा. This is basically what it is,
Yeah,
right?
it is.
The moment you glorify the difficulties involved in doing the procedure, the patient gets scared and they get demotivated. So the moment you explain to them exactly what the procedure is, but at the same time you don't drum it up into a massive procedure, patients generally get convinced. And once they do it once, themselves or one of their relatives does it, they realize that it is not a very big procedure.
Mm.
It's very predictable. It's a small procedure. In fact, it's much less painful than even extraction.
But don't you think that we have to say कि क्या क्या precautions है, क्या rare चीजें हो सकती है?
So, like I said, while you explain to them the
Yeah,
complications,
yeah.
you explain to them what are likely complications, but you don't overplay them. You know, see, whenever you do an extraction or a wisdom tooth or you place an implant, more or less the complications remain the same. And am I right?
Yes,
It's a surgical procedure in the mouth.
yes.
The anatomy does not change much. The only difference is since you're drilling into the bone, the chances of damage to the nerves are there,
Mm.
or perforation of the sinus are there. These are complications that can occur. So while you explain to the patient that something like this can happen, in procedure, you don't dramatize it. You
Mm.
try to tell them what you're looking for. That is my
Yeah. No, actually, this is true because I think Jin patient, even I have explained just these are the three steps, and these are the painkiller that you need to take. You are perfectly fine. They're actually fine, and they don't have any psychology thinking or anything because they feel the dentists are doing a lot. It's a lot about the psychological thing. Then seeing how they are actually behaving on the patient chair. So sometimes I feel to make them calm is the biggest responsibility.
So you have to understand that I, as a surgeon, when I meet a patient, it's often you meet them for a very short period,
Yeah.
right? Before you actually start the procedure. For the
Mm.
moment you come in, or I go to someone else's clinic. So the pre-operative workup is already done and actually going for the procedure. Right?
Correct.
They will meet you for, and in the first 5-10 minutes that I need them, I'm injecting them. Right? So there's no time to build a rapport.
Yeah.
So in that case, it becomes a challenge.
Yes.
Okay, so at that point, what matters is the way you inject or the way you give your pre-operative topical anesthetic to the patient. All those things matter. The words you say to the patient. Okay, when they meet you, they have to feel a sense of calm. They have to see that one of the things that calms the patient the most is your confidence. If they see confidence in your eyes and your being, they often feel very confident about you doing the procedure. That is something that I've experienced.
Yes.
So often I go to a clinic, the patients are very, very scared. So they're very scared. Often they're young. If you're removing a wisdom tooth for a 19-year-old, you're already very worked up. But if you see that you seem confident, you seem calm about the procedure, and you seem well in control of the circumstances, more often than not, they relax.
Mm.
Then, of course, you have to perform. The operative procedure that you perform, you have to do it well. Okay? Your topical anesthetic has to be good. Your injection has to be on point. The area that you're anesthetized has to be fully anesthetized. Okay? People don't remember the injection. What they remember is how the procedure went and what happened after that.
Correct.
So these are
Correct.
the two things that you have to be very good about. The procedure has to be well done and as fast as possible so that there's less tissue trauma. And after you are done, the patient is recovering. What you teach them in the post-operative medication and in the medication, the instructions that you give have to be on point. Right? So these are the things. Also, I feel in India we have an advantage that the patients can be in touch with you in their post-operative situation. I don't know how it is abroad, but I know that a lot of doctors abroad don't share their personal details with the patient. Here they have the advantage that they just pick up the phone and they text you. And it
Excellent.
happens.
Yeah.
And you should see it as a way of them connecting and often you're in a privileged position that you can allay their fears. So I tell every single patient who I operate, and this is without fail, that this is my number. I want a text in the evening of how you're doing after the procedure. I want to text the next morning how you're doing. Okay? If you want any instructions, text me. But if there's any emergency, don't wait for a text. Pick up the phone and call me. So the next question is, what is the emergency? So I tell them, if there is bleeding, by bleeding I don't mean little bit of blood in the mouth. I mean more bleeding than normal. What we expect is this much bleeding. If there is more than that, you pick up the phone and call me. So either I can give you instruction or I can see you.
Correct.
Also, over a period, we have developed certain rules, like as far as possible, never operate any case in the evening.
Yeah.
I keep the surgery between 10 and 1, or maximum till 2:33.
Mm.
Never after 6 and 7 in the evening. Because any complication which happens in the middle of the night when you don't have access to your facilities,
Yes.
your practice or your hospital, and everything becomes an emergency.
Yes.
If you operate something in the morning, by the time there is a situation which you need to manage, is during the day.
Indeed.
Because everyone is in place, your doctors are in place, your staff is in place,
Yes.
everything is in place. So that is something I recommend it to most people. That,
Yes.
whatever operative procedure that is scheduled, you keep it in the morning. And most patients understand that. If you've spoken to a lot of patients who say, oh, I have to go to work, I can come only in the evening. I explain to them this situation. That if there is a situation where I need help or I need facilities, at 1 o'clock in the night, I won't have it. I'll meet you and I'll try my best. That's not that I will not, but I will not accept.
Yes.
So they understand that situation. They modify that accordingly. See, a surgery is a surgery. Okay, it may be an extraction, it may be a repair of your ankle or your knee replacement. Everything is surgery, right? You don't trivialize the precautions that you take after surgery, and you don't trivialize the care you have to take. The
Yes.
aftercare is equally important in every procedure. Like one of the most common questions for you, which is is, can I go to the gym
Yeah.
of that day or the
Yes.
next day? It's a
Yes.
very common question. So I often tell them that you have to listen to your body. After you've done a surgery, you give your body 24 hours to 48 hours rest.
Rest. Correct.
Anything which raises your blood pressure will have an impact on how the healing occurs. And this is a worldwide phenomenon,
Yes.
right? If you take 48 hours off from your workout schedule, it's not going to harm your body,
Correct.
but it will definitely help your wound to heal.
Mm-hmm.
And that's something I recommend.
Actually, here all of this you told, there are 2 points I want to take out from it. That first, I want to ask in detail actually for all the young dentists because I think everyone is facing this. Is that the one you told? The 5 minutes that you have before you inject. That's the time the patient judge you. So what are the things that you do in those 5 minutes? What question, what things you
So
ask them?
there are two types of patients that I see. One
Yeah,
which I treat in my practice,
yeah,
which I already know the patient because I already consulted this before. So
yes.
let's leave those patients aside,
Okay.
okay? Because those I already have a rapport with.
Yes.
Now, there are certain patients who I see when I consult in different fields. Now their rapport is with the doctor who owns the clinic.
Hmm.
I am just a consultant who comes. So when I speak to the patient, the first thing is, you know, of my mannerisms, the way I present myself is important. But at the same time, I will make it a point to introduce myself. Okay, I will make it a point to ask them about themselves. What is your name? What is your age? What do you do? Where do you study? Okay. Then you say something which is a little light-hearted, depending on their profession or their
Hmm.
job or their school or their college, so that they immediately feel okay. This person is a human being, it's not a robot who's coming to operate on me. So that
Operating.
they immediately feel at ease. Okay?
Hmm.
They immediately feel at ease and they understand that this person is calm,
Hmm.
he's in control,
Hmm.
and he has the confidence. Then, if I can, I tell them that, I understand this is the first time you're going through this procedure, but I also tell them that luckily for you, it's not the first time that I'm doing the procedure. That immediately makes them feel more relaxed. Okay, they're
Yeah.
getting someone who has done this before.
Yes.
Even though they know it at the back of their head, hearing it again, maybe it just calms them down. And that is something that I
It
feel very,
comes me here only. So I think it's the correct thing
yeah,
to do.
so that is something that I always make it a point to say.
Yes. And I think this thing every consultant should use. And we are doing the consultations to the patient in our own clinics. At that time also we should say this.
Agree.
So because there the patient, anyhow they are coming for the first time. They are meeting you for the first time. They're not, if they when they start meeting you second or third, then that's the different. They know you. They know the thing they are doing, they know everything. But the first time any patient is coming, even for the consultation, if they hear just this one line, I
It
think
helps.
the it helps. It helps a
I
lot.
also feel, how you present yourself as a doctor
Yeah.
is important. Like when we were young, we were told always, you should groom yourself. And you
Yes.
should always be shaven, for
Clean
example.
shave.
Of course,
Yes.
now there's a era of beards, so it's different.
Yes.
But though, if you sport a beard, make sure that it's neat,
Yes.
right? Also, the way you dress. If you go very casually dressed, you approach a case casually. The patient look at you as someone who will be casual.
Yes.
They are judgmental, but justified because they have a mindset and they have a picture of a good doctor in their head. They see you, they should get confidence from the way you present yourself as well. So that is something that I always recommend to everyone. Like, don't go casually dressed when you're trying to present yourself as someone serious.
Correct.
Don't go, speaking casually, lightly. Don't use flippant words. Be professional in the way you speak,
Mm.
the way you present yourself, the way you approach the patient. You know, See, one of the things that we were never taught is what we call bedside manners. But for us, it is chairside manners,
Yes,
right?
I
Because
know.
we are always in close proximity to patients. So being professional in your distance from the patient is also very important.
Mm.
The way you are with the patient in the space that you are doing, you will be very professional with that as well.
Actually, this make a lot of change. I've heard somewhere, I'm not sure, but it was like one of the doctor used to come in a Mercedes and used to just come in suits every day. Whether there were patient, whether there were not patient, if there were only one patient or it's a full day. But that time, that girl who was saying the story of her, his, they told that because of that, he comes in a suit, the patient have that image. डॉक्टर बहुत बड़ा है एंड डॉक्टर ने अपने आप को क्या रखा है. सो we should also go nicely. And to be very honestly, I feel now this thing matters a lot, but no one accepts it. That they never judge you for the finance when you say. It's because if you come in a suit or something, they never judge. You say anything, they be like, okay, yes,
What I will see, a lot of patients, they want their doctors to be accurate for some reason. And
correct,
this is not here. It's an international and it's a historical statement that
yes.
patients prefer their doctors to be accurate so that they don't take advantage of it. And it's a fact.
Mm.
And like I said, the earlier era of doctors who were there, senior to us, like us,
Mm.
who we used to look up to,
Yes,
would always be impacted with it. Okay, they become in sweet, they become in silent. Our
yes.
weather is not kind, so we have to drop the suits and the ties.
Yeah,
But there's no excuse for being ill dressed or casually dressed when you go and approach a patient in a professional setting.
yeah. No, like the one you told about the weather thing, I do agree with you because it's too hot. But the second thing I would say that in clinics, the environment is never the same. What I see and what I have learned all this time, so I have worked in UK. I have learned from them that they have a particular uniform, each and everyone, whether be a dentist or whether be their staff.
But
They have their own uniform. Yes, doctor have a different uniform and then staff have a different to differentiate who are them, but everyone is clean and polished. And in UK, I have seen one thing. So before the clinic are start, so there the thing starts at 8 a.m. because they end by 5 a.m. Everyone have to come at 7:30 a.m. and check even your shoes are polished or not. If your shoes is not polished, take the cloth, clean it, and come to the to the operative room. Before that, don't enter it. Your hair should be tied for the girls because the head cap should be there. Doctors not wear, but the hair was tied. And if you are, I'm saying for the girls doctor, if their hairs are long or something, so they either tie it or either they have a hairband, and that hairband also matches to the scrubs. This what I've learned in UK, and I
even here,
find
when we studied, we
yeah,
were in a college which was
yes,
very, very strict about appearances. So all my female colleagues and classmates were so particular about the way their hair was. I mean, they would be in secondary days at that time we didn't have access to head caps, so they would tie a tight ponytail, wear a headband.
yes,
There was not one hair out of place. Our
yes,
teachers were so strict that they would point it out. And if you see that same batch of mine working today on patients, you'll be surprised or you will not be surprised that they are all exactly the same.
same,
Because that thing that is ingrained in them is followed even today.
yes.
The clothes we have changed. Now most of us wear scrubs. Most of us are dressed in professional clothes. So, otherwise, very much the same.
I think it's something that when I was in my childhood, I got my first treatment of RCT amalgam filling. I still remember that doctor, and I still remember how he came, and I have that image. I think we all have that image of doctors. Why we say doctors are white collar? It's because of this. So, second point that you mentioned that you say to your patients that text me. Do you give your text, like, do you give your number to the patients?
So I tend to because I'm a surgeon.
Hmm.
Problem is if I give only the clinic number and they message me out of hours, I will not have access to them. So I give them my personal number. I trust them not to misuse it or to call me at odd hours.
Yeah,
Okay. There are certain patients who do take liberties and message you for an appointment or call you for an appointment.
correct, correct.
But I think for the ones who genuinely need it when they actually need it, it's still a good situation to have the doctor's contact details immediately.
You should have.
And see, in India, in that term, we are fortunate that we are a little more uh, personal with the patients. We are not completely so professional that the patients can't contact us at all. On the they have access to the doctor. And I feel that's a huge advantage in our country.
Yeah.
If you're in pain, the doctor is still available to you. Or if you are bleeding for something, they are still available to you. You don't have to run to the emergency room of the hospital.
Correct.
So
Correct.
from that point of view, I think surgery is my primary job. Obviously, my answer.
Okay. And if I've seen, I just need to point out at one more point that the only thing I'm comparing is because I've seen both the side of working. So I need to ask that what topical do you use? Yeah, like in LA before giving it, because I'll say here in India I've seen they use LA sprays, but outside I've seen they are using Stephodent. Stephodent, the cream, just the gel, because they prefer the sprays make the patient gag, so they don't give that sprays.
So I'll tell you what, I'm not a big fan of this cream.
Yeah.
I use a gel. I use it on either a cotton stick or a ear bud.
Mm.
The way to use a gel, and this is something that everyone should know, is basically you have to dry the area first. A lot of people don't know that.
Yeah, they don't
The
know.
gingival area that you're going to apply, a lot of people don't dry the area. And the way to do this is to carry a glob of it, like a drop of it, and keep it in that side. What a lot of people do is take the earbud and rub it,
Yeah.
or they apply with a cotton stick or something like that.
Yes.
That works in certain situations, but a glob kept in one spot for exactly a minute
Yes.
on a dry field works best. Also, where you inject matters. If you're injecting in the attached gingiva, it always works better
Mm.
because it's slightly more flexible.
Mm.
Okay? You inject in the upper part of the gingiva, which is fixed, it is always more difficult because the patient feels more pain. With the gingiva, there is tighter. So applying a small blob on a dried field, keeping it for a minute, and then infiltrating, which will best function for the pain.
Yeah.
And the most important thing is to wait for 1 minute before injecting. And recently, I've instituted a new protocol where I set a timer after I inject, and I wait for
Okay.
5 minutes before I work on the patient. Because earlier, it's natural tendency to expect it to act within 2 3 minutes and start working. Since I started waiting for 5 minutes, I found the potency of the anesthesia to be hard now because the diffusion of anesthesia probably works better. The patients less complaints.
Mm. That's nice actually. So in those 5 minutes, do you talk to
All the time.
patient?
I'm
Oh,
always
God.
talking. So that is the time when the injection part is over. Patient is extremely happy to go careful of the injection.
Yeah.
And I may not talk to them about the procedure at all. I
Okay.
may talk to them generally.
Mm.
Because a lot of patients are very fearful of the injection. You have to understand that. Once the injection procedure is out of the way, they move on. They back. When you speak to them generally about you know, life in general and how it's treating you on those days, they kind of relax to talk about it. And it takes their mind off the procedure. So you have to understand that a lot of patients who come for surgery are not slept well the previous night.
Yes.
They have already work themselves up into an anticipation of what's going to happen. They have
Mm.
a, though they have no experience about it, they have a vision in their mind what's going to happen. And more often than not, anxiety is about thinking of something which may never happen.
Yeah.
Right? That is what anxiety is.
Yeah.
People who have anxiety are already imagining scenarios which may or may not occur. Right?
Correct.
So there's a big difference between anxiety and what you actually face. When you actually come to the procedure, I feel most people are strong enough to deal with it. And they do. When the situation presents itself, they're very tough. But the thought of preparing for it makes them feel anxious. So
Yes.
that is the situation that you have to work through. So when you start talking to them, they feel far more relaxed.
So here I need to ask one more that when the patient is very anxious, do you prefer giving them sedatives a night before?
Yes. They're very anxious, then I recommend it. And
Sedative.
certain patients are sedated, I give them a anti-anxiety shot
Okay.
one night before.
Okay.
Because it just helps them to sleep better.
Yeah.
See, another thing I always make it a point to mention to the patient. See, now most young patients have a tendency to start googling what
Yeah.
procedure they're going through. The first thing that pops up is a video of what procedure is going to happen. So
Correct.
they see blood, they see gore, they see someone drilling into something.
Yeah.
They see some sticks of blood flying everywhere.
Yeah.
So the first thing I asked them, and this is something that I've tried doing now, is have you seen any YouTube videos regarding this procedure? 50% will say yes, 50% will say no. The ones who say yes, I tell them, what did you see? So they tell me that I saw this video and oh my god, it was very painful, it was very scary. So I said, what you saw is not what you see, that is my view. Right? Only I'm going to be able to see that, not you. So what you're going to do is only feel. And this is what you're going to feel. You're going to feel a little bit of pressure. You feel symptoms of touch more than pain.
Mm.
Then I demonstrate to them often on their hand that this is the feeling of touch.
Yes.
Okay? You feel the feeling of touch? Yes. Now when I'm doing it, that's what you're gonna feel. And that's what happens, right? What
Yeah.
perceive as pressure is the feeling of touch.
Correct. Correct.
And often they're like, yeah, I can feel. And that allows them to differentiate between pain and pressure. Another way I tell them is, when I'm working, if you're feeling pressure or you're feeling pain, what is the difference? They say, oh, I'm feeling pain. I said, okay, now my hand is out of your mouth. Are you feeling that pain? They said, no. So I said, that is not pain now. That is pressure. What you're feeling was pressure. So, though it doesn't help, sometimes you have to augment the anesthesia or you have to give an intra-ligament,
Yeah.
change the position of the anesthesia. It just allows them to differentiate between the two types of things. I feel that helps them.
Yes, that's very true. And this will help a lot of patients. And actually, this make the trust that how to for the doctors and for the patient. And when they have a trust, patient get relaxed. And when they get relaxed, body get relaxed, and the things get easy. So it's not the one thing; it's really
It's a
interconnected.
combination of a lot of things, but the only thing is, see, the patient has to really trust you first,
Yeah.
that you will do a good job.
Yeah.
But they've already done their due diligence about it.
Correct.
They've gone through, they've come through their relatives, they've come through a doctor, they've come
Mm.
through whatever, they've seen some reviews sometimes. They see, so they already know that, okay, this person is decently competent in his field. But after that, like we went through all the points that, getting the patient to that point, that they trust you, that, this person is the right person for this
Yeah.
job. It's a process. Right? You go through all the different factors to get that patient to that situation that they trust you. And
Mm.
when they trust you, they relax. And when they relax, the work goes well.
Correct. So, what are the things in your clinic or wherever you go for the consultation? What are the non negotiable things that this is something there should not be?
That should not be or that should be.
Both. But I think we should talk about which is there, which should not be. Because I find there are many things.
Like what?
Uh, First of all, the hygiene. What I feel many of things that अरे hygiene ठीक है secondary है but for then I give the example when you go to some expensive restaurants do you see they are dirty you know they their reception is
So I'll tell
clean.
you, when I go to any clinic, and now what has happened is over a period, my consulting more or less are developed now over many years. Right?
Mm.
So that clinics that have been going for 25 years, there have been clinics that have been going for 20 years. A lot of the clinics have stopped going or reduced going was mostly due to hygiene issues. Okay, if I would not be confident in the sterilization protocols in that place, or the way the patient is fed or presented, or one of the most important things is how the doctor deals with the patient.
Correct.
I feel doctors who care about their patients are the ones I would want to be associated with.
Yes.
Who are looking at the patient 360 degrees, and that for me is the biggest deal clincher. A doctor who cares about his patient and who cares about the outcome of the treatment, who cares about the entire treatment going well, who are so particular about what they want. Secondly, those clinics also end up being very high ticket. So
Mm.
most clinics now are at a level, the clinics which I go to are at a very good level. Right? All of them are really senior practitioners. All of them really care about the patient and they maintain their safety, hygiene, and sterilization standards to the highest. own schedule. Okay, I understand it is Bombay and sometimes you can't make it on time. But clinics which are not aspirations about it or who are casual about timing, I don't like. Being on time, the patient should be on time, the doctor should be on time. Everything should run according to a schedule. I think that is very important.
Yeah,
Because that
it is.
reduces stress to
Yes,
everyone.
it is. But sometimes we say patients that be on time, arrive 10 minutes before, but they don't.
So
They,
that is where the doctor and his rapport with the patient comes in. Like I know patient doctors very personally, very senior doctor who I go to. She is so particular that if she calls me at 2:30, for example, okay, Dr. Darshan will come at 2:30 and do a surgery. Every single patient is called at 2 o'clock. You understand?
mm,
So if they are late, there's still a half an hour buffer. So when the patient comes, they will pre-medicate them sometimes. They will talk to them. They'll fill in the consent forms, all that. But at the same time, they are very particular with the patient which is on time. And when you give that kind of a little bit professional and little bit of no nonsense
mm,
situation, patients always respond to it by being on time. You know? So that is important because that enhances the entire standard of the clinic. First. And
mm,
secondly, it makes everything stress free. And things run on time.
correct,
You are always more relaxed.
correct, correct.
One of our biggest stresses in life is running against the clock. If you're
Very
running
true,
against the clock or you're looking at your watch, that is the most stressful.
very
If you
true.
do everything pre-prepared and you're on time, your stress reduces. So
Yes.
that's something that I believe.
I think every picture that is made on doctors, somehow they give this point that why time is important, why we say time. Because sometimes that's a very funny thing of मुन्ना भाई MBBS that he told कि मुंबई बहुत फास्ट है लेकिन जो भी चीजें होती है ना वो धीरे ही होती है.
Okay. Indian standard time is the true fact.
Yeah, it is. It is. So when there are cases like FMR cases, FMR means full mark rehabilitation cases, then that time, what do you see that what are how the treatment should be planned, how the patient should be called, what all there should be, what are the things?
With FMR, you're looking at the most implant that will not succeed.
Implant. Yeah.
So, so we have a protocol in place. See, understanding what the patient wants is first.
Mm. Mm.
Secondly, often there are situations where there are certain things left behind.
Yeah.
Now, if those are restorable, we take a choice on that. If they are not, then we decide on whether they need to stay or go. When patient first comes in, we understand their requirements. There's an interview that we go through. We speak to them about what is the goals of the treatment. Okay. Then we take records. We do an internal scan. We do CBCT. We will do photographs. Okay. In the next consultation is when we sit together. Okay, we have already assimilated all the data. We have done the pre-plan. We talk to them and we counsel them. Okay, supposing we say that certain things can be saved, certain things should not be saved. There are situations when we save the teeth for a time being, for temporary basis. But those teeth are finally not going to be part of the scheme of things.
Mm.
Okay, it's going to be a fully implant supported restoration, the jaw, both the jaw. As far as possible in these cases, we like to keep a few teeth because that gives the patient proprioception. Okay, if there are situations in which teeth are good, I don't like to extract them. Then I'll work my treatment around them. Okay, it's a myth that all implants you have to be full arch implantology or what you call
Mm.
column or
Yes.
X or
Yes.
whatever you plan. I feel that certain times having a few teeth present helps. Okay, we sometimes tell the patient that we're going to save these teeth for the simple reason that it allows us to have a little bit of feel for the tooth.
Mm.
Then we plan it on day of surgery. So sometimes we do 1 hour, sometimes we do both. Usually within 24 hours, we temporize the patient. Okay, we do temporization. On the same day of the surgery, we take record the scans or we take physical impressions. Okay, we have already done a rotation beforehand. So we have certain temporary teeth which are ready. We transfer them to the patient's mouth within 48 hours usually. Then we make the patient wait. We put him on a system of recall. Okay, 7 to 10 days later, we do secret reviews and checkups. We maybe we see the patient after 15 days for a recall to check everything that we can about the healing. Then the patient has a little bit of break for 2.5 months, sometimes 3.5 months, depending on the time required for the implant inspection. After that, we either fast track the inspections or we do them separately. It depends on how the prosthetic plan is. But that's how we go through it. Till the final, and even after we finish the final procedures, there are always 2 or 3 separate recall appointments to take the approval and the bite and the comfort of eating.
Mm.
That happens.
So here actually I wanted to give you a case and I want to know from you that how do you manage this case? Okay, so it's like if the patient comes and it's like full accretions, so definitely it goes to the FMR case. So here the patient psychology says that it's not necessary. सारे दांत को क्यों निकालना है, तो निकालने से ज़्यादा why to work on all the teeth. And as we know, we were talking before, so we will not bring that conversation for sure. But I just want to say that if the treatment is all like एक दांत class, it's somehow it's 5,000 or 10,000 example, and we go with the budget of the FMR. So they are not agreed, but the patient need FMR. So how you will explain him that you will need this case? It's up to you, but you will need this
So what we
case.
do is we treat the immediate complaint. So the
Yeah.
patient is come with pain, we treat the root canal, and the patient requires an extraction, we do the extraction. Before we go to the next stage, which is more definitive treatment, there are missing teeth or something, we'll first explain to them that this is the situation. You're in a situation where your teeth have got ground down because of certain occlusal factors, certain factors from your joints. Okay, we need to rehabilitate it to bring it as close as possible to what was originally intended. Okay? So we counsel them and we leave them with that thought. Okay? Sometimes the patients do agree and we go ahead with the rest of the treatment. Sometimes they don't. There are various factors that patients don't agree. It's
Yeah.
not always financial.
Yes.
Okay, there are times when it's a question of time, it's a
Yes.
question of understanding the concept of believing it. A lot of patients don't like treatment at all. So they do what is minimum required.
Mm.
So every case will go through FMR, go through all these procedures. But there are certain patients who believe in your philosophy, understand it. They may not do it immediately, but they come back in a few months or a year and say, okay, doctor, we had counseled you, you had counseled us about this, and you suggested that we do this treatment. So you go ahead. So every patient that requires FMR doesn't necessarily do it. But there are certain patients who agree to it. They do it.
So like but still I feel sometimes that is this all your first council appointment, or like you treat the primary problem and then you counsel all that in your second?
Treat the primary complaint, make the patient free of pain. That's the first thing. After that, you already examine the patient. So to share the observations with them is important.
Yeah.
If the patient has a need to be treated with a root canal and he has failed that, but he has 5, 6 other cavities, would you not tell him about that? You would,
Hmm.
right? Some patients say, no, I'll do it later. Some patients say, oh, is this? I didn't know about them. I had no faith. I didn't know
Hmm.
it.
Hmm.
Right? So you look at it from that point of view. So doing an FMR or any kind of rehabilitation is pointing out problems that the patient is not aware of.
Hmm.
Correct? Once you make the patient aware of it, more often than not, they choose to do it. So it's important that you examine the patient as a whole. You see all the problems that are there in the teeth and you convey to them what is required.
So this all is your first consultation only. Okay?
First definitive consult. The first consultation is about the chief consult,
Yeah.
which is already attended.
Yeah.
The second consultation is when you speak to them about
About,
everything that is
yeah.
necessary.
Yeah. So what I can figure out from you, what you told is that first consult the chief complaint, make them pain free from that pain, and then when, because everything have the 2 appointment at least. Like if we have the RCT, if it's like in today's world we have CEREC, so it's like 1 day appointment. But still that can be done like morning if we do the RCT and in evening we say come for the crumb, we will give you. So when we do that, at that time you explain the other problem also. Ki see this all are your problems.
Before we are making a crown,
Yeah,
try to do what is required. I can either make a good crown or we can plan and do your entire
and
treatment.
that
In which case, it doesn't become a single day treatment. So you
yeah,
have to stop there and explain to them and then
explain
take
to
it from
them.
there.
Correct. I think this is actually a good way because many patients, what I have seen, and I've been seeing a lot that when we explain them the whole thing, yes, it is benefit that doctor is explaining us everything, but sometimes they are like, हमें एक ही जरूरत है डॉक्टर ने सब क्यों बताया है. So there I feel here I can use what you told that make them pain free from that thing, and when they are coming back to complete that procedure, make them sit and tell them "Ki, see this all are the problems you can solve it." So this how they have gained the trust
Not
first
only
of
that,
all.
see, they are coming to you for that problem, but they
Yeah,
also coming to you for an examination of their mouth,
mount.
which otherwise would not be examined.
Yes.
You know, there is a something that has brought them to your clinic, so you have
Mhm.
treated that.
Yes.
But you are in the unique position of being able to examine the entire mouth at the same time.
Correct.
So there are times when I have examined the mouth which has no problem. You just come for a scaling and you have detected something, for example,
Yeah.
malignant.
Yes.
The
Yes.
patient had no idea about it. We recommended a biopsy. It turned out to be malignant. The patient got it treated. And
Mm.
the patient today is living a more fulfilled life because of that. Right?
Yes.
Now the same thing, see, mine is probably a more trained eye than most dentists because I can pick up something like that.
Yes.
But every dentist who looks inside the mouth has a primary responsibility to examine everything. Okay? Right from the floor of the mouth to the roof of the mouth, to the buccal mucosa, to the throat, to the teeth. Right? So once they do a thorough examination and they record their findings on paper, they're in the unique position of asking the patient to get them treated.
Correct.
So then the patient is out whether they want to treat it or not.
Mm.
And most often they get the treatment. It may not be a full mouth rehab, but the rest of the treatment they do get.
Correct. Correct. No, that's true. And once they understand each thing, they goes to the cause. So what I the time I've started a lot about the dentistry, learning each cases and making content on it, I understood that it's not only about the situation. We should always treat the cause of it. Till the time we will not treat the cause, that thing will come. For example, if you're staying in a building and basement में problem है and the second floor light is going, so you are treating your light on second floor कि ठीक करो but वो बार बार जा रहा है. But till the and then afterwards you saw that basement में problem थी. So till that time you will not treat the basement thing. How will you solve the second floor thing?
See, any critical field, okay, your treatment is not complete unless the cause is available.
Yes.
Right? Now, if there is an infected vegetable and there is a cyst around it, then you removing the cyst is often not enough
Yes.
unless you remove the infected vegetable. Similar to that with situation. If there is an infection, and you're treating only the infection without removing the tooth which is involved. It's an incomplete treatment. Right? That is going to flare up again. It will go to a chronic state where it will again pick up into an acute state after some time. So,
Correct.
elimination of cause is the number one principle for treating any patient in any field, not only in medicine. So you have to be very careful about what you're doing.
So as we already talk about that, there are two type of patients, and one was who are very anxious. So how do you calm those anxious patients?
With the words,
Like
you tell them, see, like I said, it's a process. Everything, right from the time the patient meets you for the first time. Okay, you talk to them, you convey your confidence, you convey your credentials, you convey your personality to them. Patient walks in, the space is important. You have to look at, okay, the lighting, the smell, okay, the music, all those things are important. So when the patient comes and sits, you speak to the patient, you examine the patient. Sometimes you have to understand that using big words, using difficult phrases,
Yeah.
makes the patient more anxious. Okay. Again, drumming up a procedure or making it sound more impressive is a big mistake.
Mistake.
Okay. Downplaying the same procedure but explaining to them exactly what it is sometimes works. Okay. There are situations in which, by doing that, the patient calms down.
Correct.
There are times when, you know, they require the procedure and you sometimes have to just have your assistant hold their hands while you're working on them. That also helps.
Yes.
So many patients are there who will clutch the patient's hand while the whole procedure is done, or they have a relative whose hand they want
Yes.
to hold.
Yes.
These are things that are important. So in surgery, I don't allow the relative to be in the operating room at the same time.
Mm.
So that is a rule of thumb.
Mm.
Because I often feel that a patient, the relative looking at a surgery gets more nervous than the patient himself. And often that person goes through fainting spells and stuff like that, which I don't want to them to go through. Then I have to leave the patient and deal with them. That
Mm.
becomes more of an emergency. From that point of view, sometimes I feel that the calming your nature and the situation in which the patient is in often calm the patient down. And after that, you have your words. You have to be very calm. You have to be you have to be in control. You have to be relaxed. You have to be more empathetic towards the patient. The empathy is something that you can convey to the patient from your personality. That is what you have to do.
Yes.
So the patient feels you care and you do care. The patient often responds to it
Mm.
with relaxation.
So, I have seen somewhere about the business who are having a multi-millionaire business, and he was asked one question that what is USP? So, US like for the other, like what is your USP? So here I want to clarify USP means what is a unique selling property for everyone that they are seeing that they have their own thing. But when I was seeing their videos, I understood that many things are not what they use, it's not for us. Because they have the different business and each have their own business. And this podcast is mainly, I feel it's about the doctors. So I want to make this point that what is your USP? And it's very important in today's world. So what do you feel?
Very interesting. I never thought of that. But I would say my experience and my ability to do things well but quickly is my investment. Like I would consider myself as a decent surgeon who does the procedure fast and with minimal tissue trauma. And if you ask me, I think that is my best. And I'm empathetic towards the patient.
Mm. But this goes with the doctors, correct. But if you want to, after all, patient matters, they need that trust. And they are, I would say that in 1 second they judge you. They judge. They will not see what you are. They will not, they don't know about our experience. Yes, many times I feel everyone is taking care of their personality so much in today's world that no one looks older in their age, but they have a lot of experience. So what that 1 second you get,
Why don't you tell me? You now spoken to me for answer. What is my USP?
uh, I think the calmness, and I think as we were talking about the soft skills, I think your soft skill, and I think you hear the patient. For example, before we started shooting this, we were talking. So I feel you heard me. You heard each and everything about me. What I am, what my intent, what I want. I think many of us, a young dentist, including me, we don't understand what patient wants. That's what I feel, and that's what I feel that you have. But still, I've gave you the highlights. Now I want that in from you. That what you feel.
I feel, see, hearing the patient out is very difficult. This, no one hears anyone. The patient wants to be heard. They have complaints. There was a time before earlier, the doctor would actually sit down and write the history, right?
Yeah.
Now, if you go to very senior practitioners even today, with another ailment, they put and write down the history. Now, the important thing is it's not about writing it or recording it. There are various devices and methods to record, but it just gives the patient time to speak. There are
Correct.
times when a patient comes and we just don't even sit on the medical chair.
Yeah.
Okay? So you have to understand that I'm almost now a very senior dentist. So I get a lot of patients who have been to multiple dentists and they come to me for an opinion. They often come to me with a file which is this thick. Okay, they've been everywhere. They've been to dentists, they've been to oral surgeons, sometimes they've been to plastic surgeons, they've been to ENT surgeons, they've been to various fields. People have tried other allied fields and sometimes even alternative medicine to solve their problem. So when they come to you, they come with a story, right? And when you sit with them, they want you to hear their story. So that's part of the healing process. When we sit together and we hear them out, so we hear what they're saying, we hear what is their experience, and you'll be surprised how often you know what the first dentist or the first oral surgeon picked up was the right diagnosis and the right point. But then the path that they took diverted from the right field and they went to the general practitioner referred them to an ENT surgeon who referred them to an orthopedic surgeon who referred them somewhere else and finally they ended up with a naturopath or some Ayurvedic doctor who's been giving them something. So the actual diagnosis has now been left aside because the path has changed.
Hmm.
So sometimes when you hear the story, you can make your judgment. And I feel a lot of patients who I've seen, I feel, by hearing them out and by coming up with a solution based on what I feel for the initial
Hmm.
diagnosis which is correct.
Yes.
We have very talented specialists in our field who have seen the patient and made a diagnosis. But eventually the patient has just lost the path. Lost. So hearing the patient in any field, we spoke before. What we were saying about young dentists, everyone wants to be heard, right? What we call our social media about. Social media is about portraying yourself and being seen. Right? Being seen is often not only for portraying a different lifestyle or to be seen in a different light, but to be seen and recognized for what you are. Right?
Correct.
And it feels similar. Right? They want you to hear your story. Right? I think maybe if I was a better listener, I would probably be a better doctor.
No, I feel, oh no, I feel you are a perfect listener. I would definitely say this. And you are a great doctor. Like, no, I feel because, okay, I have been mentioned this before, but I want to say this that I have been following you since my first year. And yes, we were not that contact, we were not in those things, but we usually say when you work great, your work will show what you are. And in today's world, we are definitely trying to show what work we are doing. But that time, I feel you already showed us what work you are doing, what you are behind. What That's why I think today's otherwise my most of the patient are always podcasts are always patient centric. But today I genuinely took time to make this doctor centric. And today we just talk about the doctor's thing, that how to manage, how to talk about them, what how to dress, how to make your clinic environment and everything. So I think this podcast takeaway is this for today's. But yeah, this is the major USP I feel, and when everyone will get into it, I think the dentists that have been mostly told कि अगर आप निकलोगे ना तो थाउजेंड ऑफ डेंटिस्ट है. But when you start this thing, I think those all the thousand dentists will be number one dentists. They will start growing. So
And
yeah,
dentistry as a profession needs to grow. I tell
yes,
you what, the one thing that we need to do is be united and dentistry is a great field. Okay, and that is genuinely something I believe. When I speak to some of the younger dentists, so sometimes on social media I see a lot of people bashing the profession. I feel
yes,
sad because I feel that dentists I owe everything to them. Whatever I am, my parents were, my father was a dentist, so our whole life is built on dentistry. And I think it's a great profession. Okay, it's only one of the best professions in which you can do what you love and make a living out of it. So I feel there is a waiting period. So there is time that you have to spend honing your skills for sure. And that time is time well spent. It never goes waste.
Yeah.
Therefore, you have to spend your time and spend your effort in getting the skills to
Yes.
practice in the field. But I personally believe it's a fantastic. I give a message if there is any young dentist watching, don't lose heart and don't lose faith. Keep it going. There's a time frame. There's no time frame for success. But
Correct.
when it comes, it comes quick.
It
So
comes
just
right.
hang in there and focus. Okay? And pray. And take care of your patients.
Yeah, that's very true. So, one last question, and then we will be ending this podcast. Is that everything has its pros and cons. There is nothing only with pros. So, for dentistry, I know you love dentistry, but what are the pros and what are the cons?
See, the pros, of course, I already highlighted. I love
Yeah,
the profession. I think it's a great profession.
yeah,
That you're your own boss. You have all the facilities. You treat patients. You can make them pain free, and you can make them happy with their smiles. Both ways. Okay. So what you do is unique. Not many people can do it. So people will trivialize the industry as being something small. The fact is, whoever trivializes it should go through a take once, then they understand how important their job is.
yeah,
Or they should face something like a broken tooth, then they realize how difficult your job is. To extract or distribute to extract.
correct.
The con, I feel, is of course the expense of the cost. It's a huge expense to get to where you are. It's a difficult path, going through your whole entrance exam field and
Yeah,
choosing the profession. The course itself is difficult. After you graduate, the immediate returns are less, and when you invest, the expenses are big. So I think that is one of the cons. But having said that, there will come a time when the balance is maintained. When you have all your stuff in place and you start enjoying the profession, and that's when the returns are coming through. So I think we just be patient,
yeah.
and trust the profession and trust the field. Don't diss it, don't hate it. Hang in there, your love will come through for the profession.
I think trust yourself and trust the journey that you are going through. You will get there, and good things take time.
Absolutely.
It will never be like चलो आज सोच लिया और कल अच्छा हो जाएगा. It will be never. And I feel personally, because in my journey I have seen many roadmap of down and up and down and up. The one who knows me will definitely agree with me on this point. But I feel till the time you will not see the failure, you can never feel how success feels. If you will never travel in auto, you will never feel what's the like crave to drive that BMW. So just travel once in auto to get into the BMW.
Go through the process. Work from down up.
Yeah.
Most business houses you go from the down up, so you understand what every field is about. So I feel that it is a part of toughening yourself as well and understanding every field that you are into, and
Mm.
you will appreciate it even more.
And you will respect and value that. Because if we get easily, we never respect it. So to earn that respect, work on it. That's what I think I'm doing right now.
And you will be successful. It is very you're already successful in what you're doing, and you just have to recognize it, and you'll see when you look back after 10,
Yeah.
15 years, you enjoy the process. You see
Yes.
that right now because you're young, you are thinking about it. But when you become a little more mature and a little more experienced, you look back on the journey and love it.
Yes, that's true. That's really good. Thank you so much,
My
sir.
pleasure. Thank you very much.
This
Thank you for
was
inviting me on your podcast. Thanks a lot.
Thank you for coming on it. And this was like something I think each and every doctor should watch. They will literally learn what are the takeaway that I am taking from this is respect what you are doing, hear your patients out, and never give the treatment that benefits to you. Give the treatment what benefits to the patient, and patient is yours. They will they will trust you like something else. So just be calm and patient. That's what it's the main highlight and takeaway from this podcast for me today. So thank you so much for